cause of renal failure, acute renal failure, is from this acute tubular necrosis. What's necrosis? Cell death. So, this is a slide that I had in my PowerPoint. Just take some notes, kind of more for yourself. So, as I thought to myself, 50% of all acute renal failures are from acute tubular necrosis. I think we should talk about that, right? Did you see this? Yeah. So you have a short-term tubular necrosis. What do you find tubes in kidneys? Proximal convoluted tubule, distal convoluted tubule. Oh, that's a big part of the nephron. Reclaim all the good stuff. So if that starts to die, is your kidney going to function? No. So you have death of the tubular epithelial cells. So if you wreck up that tube, you're not going to be able to function. What causes this? Ischemia. What's ischemia? Yeah, lack of oxygen to the tissue. So if cells don't get oxygen, what happens? They die. So somehow I have some ischemia, some renal artery stenosis, which means naturally that the blood vessels are smaller. You get less blood, less oxygen, the tubes are going to start to die. Those cells. Embolism of the renal artery. What's an embolism? Yeah, big blood clot comes along and floods it. If it floods it, are you getting oxygen to the kidney? The cells don't get oxygen, what happens? They die. So these tubes start to die a little bit. The kidney's going to fail. Nephrotoxic drugs. So do patients take crazy different types of drugs? Yes. Antibiotics such as aminoglycosides, statins, or cytotoxic drugs such as cisplatin. I think I've heard that one before. Or when patients drinking antifreeze. I'll talk about antifreeze in a second. It's not a fun story. Okay, wait. Antibiotics are good, right?
No.
Can we survive? Well, antibiotics are good. Overall, antibiotics are good. Can they have a toxic effect on the body?
Yes.
The liver's going to be toxic or stressed out, but also can an antibiotic start to create renal failure? Yeah. So you're solving one problem, causing another problem. All right, this antifreeze. You know how antifreeze tastes? Sweet. Sweet. It tastes really sweet. How do I know? I have not tasted it. Yeah. But if we ever wanted to kill a stray cat on the farm, you know what we used to do? Put a little bowl of antifrease out there.
That's me.
And a cat would come along and it would drink it. It was sweet. What would that cat do in a few days? Die. Because why? Acute tubular necrosis. You guys ever live on a farm? Who lives on a farm? Yeah, stray cats. They're like annoying.
You don't want to kill them though. When we kill that.
Yeah, really? Where were you? I'm joking. You don't do that. Now we make sure. My dad said, whenever we're done with the antifreeze, fixing a car or whatever, we'd always make sure it wasn't laying out because the stray cats or our own cats would drink it and they would die. Why? Renal failure. That's not good. And what are you going to see? You're going to see the muddy brown cats. When you think of cats, what do you think of? Like the long cylinder. So if you look underneath the urinalysis and you see these muddy brown cats, oh my gosh, what do you have? Acute tubular necrosis. It looks like that was right in a tube and it made its way out. Are you heading towards renal failure?
Oh yeah.
Or you're into it? Good. Anything else on here? How do you treat this? Well, your kidneys are failing, so you better do aggressive treatment and solve whatever is causing that. Solve whatever is causing the stress out to live in the kidney, solve that problem, hopefully the kidneys can come back. Good. All right, you guys like that one? Okay? That's a long way. All right, I think we're getting close to the end. Incontinence. Thanks for that. Incontinence. This means loss of bladder control. There's different types. Stress, urge, overflow. There's 3 types. The stress incontinence is basically just put more extra stress onto the bladder, and some of it comes out, some of the pee comes out. How many going to have stress incontinence? Yes. Yeah. My wife told me not to make her laugh when she was pregnant. Don't tell her I told you this. But of course, it's like, okay, Mom, right? So I make her laugh, and guess what happens? A little pee came out. I made sure she doesn't walk away from me. That's kind of gross. Because when you have a baby inside here, is it putting extra stress on the bladder?
Oh, yeah.
And so all she has to do is laugh, contract the muscles, and it comes out.
Does it
Most
also?
common in women.
I have a question.
Less than 60, yes.
So it's also a part of more fluid volume too with pregnancy, doesn't it?
Yeah, you're gonna have an increased urge. Well, this is why. Let me back up. I think no, it's pressure. It's pressure on your bladder from the baby pushing down.
Okay.
Thinking about hypertension, maybe is why you're kind of bloated a little bit that way. But if you think about this, when you have, like, we're not pregnant. I'm not pregnant, right? So whenever I get up to 500 milliliters in my bladder, it starts trickling or pushing stretch reflex, and I start getting the urge to pee.
Mm-hmm.
So just imagine as a female, if you have less than 500 milliliters, but you have a baby pushing onto it, you're going to increase your chance of getting that urge to pee, even if you have less pee in the bladder.
I was just thinking more filtration. That's what I was thinking, but that makes more.
Oh, you're creating more urine? Yeah, I can see that too.
Yeah.
Because your metabolism's high, making that baby. Yep, I like that. Cool. All right. So stress incontinence, think about the pregnant woman, or let's say you just have weak pelvic floor muscles after the birth.
Yeah.
Because your muscles get stretched as a woman's body goes through some trauma. So if you don't do those exercises to make your pelvic floor muscles strong, you can have incontinence by just lacking speed and increasing abdominal pressure. So how do you fix that? Just tell them to strengthen those muscles. Pilates, right?
Does the hormones affect them, like towards the end of pregnancy?
Yeah, when you get pregnant, you have this hormone called relaxin,
Yeah.
which relaxes the ligaments. And I'm a chiropractor by training, you guys didn't know that. Women after pregnancies and during pregnancies are awful patients because they're so loose and floppy because of this hormone relaxin.
Yeah.
So like they're bendy, twisty, it's really tough to get them aligned a little bit until the relaxin hormones get back to normal, low, and then it gets a little more stiff. What's the purpose of relaxin? Relax everything to get that baby out. So it serves its purpose. Does that make sense? Is that good? I think I answered that. All right, urge incontinence, or for example, are also called reflex incontinence. This is where you have tickling of overactive nerve sensations, which cause extra action potentials to make you contract, and the little pee comes out. So that's kind of, if you have urge incontinence, you start thinking, oh, neurological problem,
Parkinson?
maybe what's going on. You think a little bit more older adults. Most common older adults, where you have more increased chance of neurological problems anyways. So you're going to have uninhibited involuntary contractions of the detrusor muscle. What was the detrusor muscle? Detrusor muscle? The big muscle on top of the bladder that contracts and pushes the pee out. So if an older patient has increased action potentials of that muscle, what are you going to do?
Detrusor.
Yeah, incontinence. Do you have a patient with incontinence? Yeah. So on a history, the patient might say, hey, I feel like I have to pee all the time, and sometimes I can't make it to the bathroom and I pee myself. What do they have? Urge incontinence. Maybe. Okay. So if it's an older patient, should you check out the neurologics and the nerves, make sure they don't have anything hardcore, like what? Parkinson's, MS. What's MS? Multiple sclerosis. You guys cover that? Yeah. So which means you don't get the myelin. Do they have weird action potentials going all over the place? Yeah, different speeds. Or a central nervous or peripheral nerve damage. Okay. Just because you're old doesn't mean you're going to get incontinence. Just because you're old doesn't mean you're going to have dementia. Those are uncommon. Just say, oh, they're old, they pee themselves, and they have no clue what's going on. That's not normal. That's not normal. So when you guys take care of me, I pee myself, I don't know who I am. Treat me, fix me. Don't just kick me to the curb. All right. Overflow incontinence. you're a male, you could have benign prostate hyperplasia, BPH. I'm going to talk about a little bit. It's basically you have some pressure on the urethra, which is kind of create a backflow. The pressure builds and speaks out. So the bladder is always full. We have a hard time getting it through the urethra. So when it does come out, it's like pressure, and it kind of dribbles out a little bit. Signs and symptoms. Signs and symptoms of UTI. Increased frequency, maybe, I don't know if there'd be much pain coming out. Maybe just it's difficult in urinating. Okay.
Can a strep infection cause that as well?
A strep.
Yeah.
If it takes hold in the kidney, like a post-strep glomerular nephritis.
Yeah.
Yeah, if you have an infection in the kidney and it starts to spread and seep down, could it cause that? It could cause a UTI.
Yeah.
Yeah. Yeah. Very rare, I would say, because most people go get antibiotics nowadays. But I guess if it's untreated, you just have no money, you don't go,
Yeah.
go get treatment, maybe. Third world country, maybe. When you think about your medical mission trips, you see some things you don't see in this country. Yeah. All right. Here's, let's call him Fred. Fred Flintstone is a 72-year-old male. Oh, you know what that means? Dementia. He's
Oh no. Wrong.
Fred is a 72-year-old high school principal who's about to retire after 40 glorious years.
Wow.
Gosh. Of hurting kids and being verbally assaulted by their parents. It should be like 72-year-old, how about this, retired